Hi everyone, my name is Jenna and I wanted to create this blog on pleomorphic adenoma because it's currently my diagnosis. So in March, I noticed I had a little nodule behind my left ear, and it's just right behind my earlobe. They said it measured about 4 millimeter when I first felt it in March, and I noticed it when I was in college in New Mexico, and where I graduated this May with my nursing degree. So I noticed it in March, and unfortunately, my health insurance did not cover doctor's visits in New Mexico because I am a resident of California. And so my only option was to go to the emergency room. And so I went, and I also didn't have any pain, didn't have any other symptoms associated with it. Just a little knot in my neck, pretty much. And so the ER physician looked at it and was like, well, since you're not in any pain, you're going to go back to California in a couple of months. Just keep an eye on it. If you notice a change in size or if you start experiencing any pain, come back. We'll take care of it from there. And so I didn't feel any pain. I just tried to get through the rest of nursing school and graduate. And, I was going to be going home soon and I could take care of it. So I came back home and I got in with my doctor, and then it was a whole bunch of referrals from there. So it was then to the ENT where he felt it and was like, let's do a ultrasound. And so I did an ultrasound, and then it was like, let's do an FNA, which is a fine needle aspiration, and then they biopsied it. And so they biopsied it, and those days following the biopsy were the absolute scariest couple of days. I was like sitting by my phone just waiting for them to call me with the results of it because I was just terrified. So I get the call, and the doctor tells me I have pleomorphic adenoma, which is a benign tumor of the parotid glands. And I just praise God that it wasn't cancer. I was just terrified, being 23 years old and just graduating with my nursing degree. It was just like so a lot of mixed emotions. Obviously, thanks to God, I don't have cancer, and I can get it out. My doctor was telling me over the phone, well, there's a lot of side effects from getting the surgery, paroidectomy, and one of them is facial paralysis, which is like the big one. And he said, well, it can be devastating to someone your age. I mean, it can be devastating to all ages, but I'm just wanting to start out in my nursing career, and then I have, this, and it's terrifying. I looked at other people's blogs, and they were all the same way, very scared, but every blog that I've seen, these people have had great outcomes, and that's like the purpose of creating this blog, because the other blogs that I've seen have truly helped me get through this process so far, and I hope that I can help you or your loved one or whoever's going through this, to see that there is light at the end of the tunnel, and there's many people that have this tumor, which you can see if you Google it, like I've done a million times. So basically now I have my consultation for surgery next Tuesday, so a week from today, and then I have my surgery scheduled for 4 weeks from now, 3 or 4 weeks, one of the two. And so my thoughts, my feelings, I'm very scared about surgery. So I am going to be updating this blog pretty frequently, just sharing my thoughts and concerns. I'll post about my consultation next week to kind of tell you what the doctor told me, about my millions of questions I have written down to ask him. So hopefully it'll answer some of your questions that you're feeling. And, another thing is that since I'm in nursing school, I want to always practice health and wellness, and I eat healthy, I exercise, um, 5 to 6 times a week, and I don't smoke, you know, and I have a tumor, and things happen to the healthiest of people. And just know that you or your loved one, whoever's going through this, you know, other people are too, and it's not, there's no blame to it, and it can happen to anyone. So you're not alone, and I hope this blog can inspire you and help you get through your situation as well. Take care.